Partnered by Times Influence.
An initiative that is slowly changing lives and an organization that is determined to change the face of healthcare in our country. VivoHealthCare, through their uniquely designed programs, is skilling the youth of the country in very technical aspects required in the healthcare sector. It offers a wide range of educational and training programs, including career training, health and safety, and emergency life support.
We are the largest health and safety training company in India. Our motivation is lives must be saved. So we work with school children, school teachers, we train people in the community, in corporates, in companies, in hotels, on highways. We also train doctors, nurses and paramedic staff.
मुझे मेडिकल लाइन में जाना था, लेकिन वहाँ की फ़ीस थी बहुत कॉस्टली थी, तो इसलिए मुझे आफ्टर ग्रेजुएशन के बाद मुझे मेडिकल कॉलेज में एडमिशन लेना था। लेकिन जब मुझे वीवो हेल्थ केयर के बारे में पता चला तो फ़ीस भी ज़्यादा नहीं थी यहाँ पे, और स्टडी भी जब मैंने एडमिशन लिया तो मुझे यहाँ पे स्टडी भी अच्छी लगी।
आप आराम से पूछ के क्लैरिटी है।
The programs by VivoHealthCare focus on both health and education. These programs offer a hands-down practical experience of various professions like dental assistants, dialysis technician, radiology technician, medical laboratory technician, general duty assistant, and many more. The length of the training varies according to the course structure.
The big need in India is to solve the problem of health, not only in the urban centers but also in rural centers. Having said this, in the last few years, many new hospitals have come up. They are largely in the urban centers. As the hospitals are coming up, the challenges are getting enhanced due to shortage of doctors, shortage of nurses, and shortage of paramedical staff. So Vivo is working with corporates to enhance the number of paramedics that exist in this country, the quality of paramedics that exist in the country, and we are channelizing youth, mostly unemployed youth who are looking at a career in healthcare and making them employable. That is the core focus of VivoHealthCare.
VivoHealthCare partners with corporates through their CSR wing with support from the Government of India in order to run these programs in different regions of the country.
We have initiated training in sectors like dialysis technician, radiology technician, medical laboratory technician, general duty assistant, and home health aid trainings.
Journey, we felt that there was a larger purpose, and that purpose was making India health confident, which meant that not just financing tools for healthcare like health insurance, but also playing a role to building up healthcare capacity, particularly in the districts and villages which do not have sufficient healthcare facilities. And that's one of the prime reasons why we went into a CSR project which leads to skilling of young women who we believe have a very important role to play in the healthcare of India.
These partnerships allow a wide implementation of the training courses and are able to affect considerable number of youngsters in their quest to acquire skills and gain job opportunities. Their tie-up with different hospitals in the country allows the students to secure jobs in the best of medical institutions.
The community has supported us, the industry has supported us, the government has supported us. We have worked with projects with ONGC under the Swalamban project, where we are training people who are underprivileged. Roshni project, where through Apollo Munich, we are training women in tier 2, tier 3 cities. Garib Nawaz through Ministry of Minorities.
One such center operates in Sector 44 in Gurugram. Supported by PTC India Limited, it offers skill development training to the youth and enables employment in the healthcare sector in areas such as dialysis technicians, radiology technicians, medical laboratory technicians, general duty assistants and even home health aides.
Our aim was to target the youth who are 10th or 12th class pass outs and who are not equipped to take up any proper job in the market available in the country without any specified skills. With this initiative, our board of trustees and the CSR committee of the companies, they decided that why not we invest our CSR funds in the skill development sector. With this aim in view, we started our partnership towards two sectors of skill development, but the major focus which we are trying to put now is in the healthcare sector. And for this purpose, we have partnered with VivoHealthCare Limited.
VIVO में मैं आया तो पहले कोई इतने ज़्यादा सपने नहीं थे, ये था कि हॉस्पिटल में जॉब करूँगा, 15-20 हज़ार 5-6 साल तक में मिलने लगेंगे, अभी 8-10 मिल रहा है, इसके बाद धीरे धीरे 20 हज़ार तक मिलने लगे, अपनी ज़िंदगी चलेगी आराम से, इतना ही ख्वाब था। लेकिन जब से यहाँ आया हूँ तो अच्छा नॉलेज और पढ़ाई के ज़रिए टीचर लोग अच्छे हैं, बहुत अच्छे समझाते हैं हर चीज़ कि ये ऐसा है, जो पूछो कोई बुरा नहीं मानता है यहाँ पहली बार। और एक यहाँ आके एक लाइफ स्टैंडर्ड बन गई है सर कि मतलब कैसे जीवन आगे चलाया जाए और क्या किया जाए क्या ना किया जाए। पहले ये सब नहीं था सोच कि क्या सिर्फ यही था कि जॉब करनी है, अब तो ये है जॉब भी करनी है, पढ़ाई भी करनी है, आगे लाइफ अच्छी बहुत कर लूँगा, ये कॉन्फिडेंस आने लगा है।
Shehnaz did her emergency medical technician course through VivoHealthCare's training program and for the past 10 months has been working at a hospital in Gurugram. Coming from a humble family background, this was a big opportunity for her. The salary from this job is helping Shehnaz in supporting her family and also manages expenses for her further education.
बदलाव सर लाया क्योंकि सर पहले हम सिर्फ घर में रहते थे, उसके बाद सर जैसे ही कोर्स का पता चला हमने कोर्स किया, बट सर जॉब भी हम कर रहे हैं, तो सर सबसे बड़ा बदलाव तो यही है सर कि हमने अपनी लाइफ में जॉब करना भी स्टार्ट किया। अदरवाइज सर कोई उम्मीद नहीं थी कि हम लाइफ में जॉब भी करेंगे। कोर्स कंप्लीट हुआ तो इसके बाद फैमिली ने भी कहा चलो कोर्स हो गया है कंप्लीट, तो जॉब के लिए भी वो मान गए, अदरवाइज सर नहीं मानते कभी। और जॉब करने के बाद सर अपनी स्टडी, जो मेरे स्टडी का जितना भी खर्चा है वो मैं खुद कर रही हूँ, बाकी जितना हो सकता है घर में भी उसमें हेल्प करती हूँ मैं, तो जिससे मेरी फैमिली में भी सब खुश हैं।
Being a surgical center, we would like to keep our cost at the minimalistic, because the only reason why we are able to create the efficiency and the productivity and at the same time controlling the cost factor for the patients is by reducing the other overheads that we have, which the larger hospitals have and we don't have. So what we require is the skilled labor, the skilled staff to help us grow as and when we need people. I think VIVO has a spectrum of medical specialty people whom they have trained, and we can pick and choose the kind of people that we want in each spectrum of medical line. So, and I would say as and when we grow, we would like to increase the number of human resource that we want in the medical line, and VIVO is the first point of contact. If I need any technician, or if I want to start a radiology department, I can ask for somebody who can be a technician with the radiologist, or if I need to increase my number of patients or the rooms, then I can ask for somebody who's a trained nurse. So these are the kind of things that I think it's just at the back of the call. If I speak to somebody at VIVO, they're available to help us.
And Shehnaz is not alone. There are many stories like hers that have changed and rewritten their destiny with a little help from VIVO's healthcare training programs. After the break, we bring you some other initiatives by VIVO Healthcare and the difference it is making.